Chiropractic Council, Dr. Bryan Ludwig, Albany District President.
Thank you for having me here to testify today. I testified in 2014 before the Workers' Compensation fee schedule hearing. I want to thank you for having that hearing. It was instrumental in Workers' Compensation Board.
Just for you.
Huh?
Nothing. Keep going. I said you're doing it. You did it just for us.
Yeah. Thanks. So yeah, that fee schedule is no longer going to be put into effect. Appreciate that. And we also want to thank you for proclaiming September as Chiropractic Health Month. We would like to draw your attention to some pending legislation. Again, we have the Medical Partnership Bill. We feel that that would be instrumental in changing the culture of healthcare in New York State. As I sit here and I listen, I've listened to other years when I've testified, we keep hearing about how there's more and more ill people, and there's increased cost with that, and if it's not handled at the local level, then it goes to the hospital level, and there's increased costs there. But what about just having fewer sick New Yorkers? You know, that would lower the cost for a lot of different things. In the past, I gave some testimony on Blue Cross Blue Shield of Chicago and how they reduce costs and things like that. And we can get into that more if you have some questions on how they reduced pharmaceutical costs by about 80%. I wonder how big the Medicaid budget is on just pharmaceutical costs. It's a funny question, but I know we know that answer. As a chiropractor, we start to think, and I'm looking at things that are promoted as health and healthy. And to me, that is the major issue, is that those things are not healthy, that are usually promoted as that. Quick fix of treating a symptom, not finding what was causing the symptom, leads to chronic illness, wasteful spending on health care, and it just spirals and spirals. Chiropractic can help New Yorkers achieve true health. We do it safely, naturally, and in a process can save the healthcare system lots of money. So if you want to spend less on prescription drugs, needle surgery, if your goal is to have fewer heroin addicts among young New Yorkers, you've got to reach the person before they become an addict, before they become sick, before they become diseased. You must put and keep them on the road to good health. So how do you do that? Well, we heard some people today talk about good nutrition, smoking cessation, all great starts. A place that we keep going, and I keep saying this is not health, detecting an illness early is not preventing it. You first have to bring the person to be healthy before you can, if you do that, then they're not going to be sick and you're going to lower your costs that way. So we focus on the chiropractic, and Chiropractic Council focuses on how the body works as a whole, without drugs, without surgery. So before early intervention, before detection, before screening, we don't pollute or modify the body chemically, merely to mask symptoms. We help the body return to normal function. So it's like if you're driving down your car and you're going through the tunnel and you're listening to your radio, all of a sudden you can't hear the radio. Well, maybe the message to your radio isn't getting there. You don't need a new radio. You don't need to cut it out. Okay? You don't need to inject more electricity to it. You just need to get the message there. So that's what we do. We get the message there. From the brain to the body back up to the brain. So, a case in point, Medicaid, chiropractic care could substantially help many Medicaid eligible New Yorkers, but we're unfunded. So I have Medicaid people coming to me and they're paying out of pocket for preventative care, 100%. Why? I could have read the whole testimony, but I kept it to 5 minutes.
Thank you. Thank you very much. Any questions?
Thank you.
Okay, thank you.